A woman writes, I get horrible cramps after orgasm. They eventually go away, but I feel myself trying to prevent orgasms to avoid this. How do I get this to stop?
So the official name for this pain is dysorgasmia, which simply means you're either having pain either right before or after your orgasm. For women who experience pain after they orgasm, this cramping can feel like period cramps. Often it happens right away, and unfortunately, it can last for even a few hours after sex. This pain can be anywhere in your vagina, lower abdomen, or even low back. It's typically nothing to worry about. Think about it this way. Your uterus is a muscle and it contracts when you orgasm, like any other muscle in the body. You may have some discomfort after it gets a workout, and an orgasm involves the involuntary contraction of the muscles in the pelvis and pelvic floor. In some cases, though, it could be a more serious condition that can trigger this pain. It could be ovarian cysts, uterine fibroids, pelvic inflammatory disease or PID, or endometriosis. So it's definitely worthwhile getting checked out. It could be a less severe condition, like a result of bowel issues. Issues with the digestive system can often cause abdominal cramping. Things like constipation and gas are a common cause of stomach pain after sex. Irritable bowel syndrome can also cause cramping. Problems with the bladder or urinary system can also cause pain after sex because the bladder sits right in front of the uterus, and intercourse can really irritate that, especially after you have a UTI. There are some other STIs like chlamydia, gonorrhea, and both of those can cause abdominal cramping after intercourse. So it's probably nothing, not a big deal, but it's always best to see your doctor and get tested.
Dr. Leah, a new discovery. I just found out my husband watches porn. I just don't understand this. Is it unrealistic to ask him to stop watching it?
Yep. It's probably unrealistic to ask your partner to stop looking at porn and expect that he will actually do so. Even if he complies, I'm assuming that he will just do it behind your back. I know it's not the answer you wanted to hear, but you should know that almost all men watch porn at least occasionally. I think the question that you need to ask yourself is, why your partner's porn watching is bothering you? Is it because you think your partner isn't attracted to you anymore? Do you see porn as some form of cheating? It's unlikely that your partner's porn watching has anything to do with his feelings about you, his attraction to you, or even the relationship in general. Keep in mind there are different types of porn. Now, some porn might seem aggressive or off-putting or even degrading, but other types of porn can be sensual, and some other types of porn are even designed for couples. So you might want to ask him if you can join in on the fun. There is one exception to this, though. There are guys who watch porn compulsively and are addicted to porn. If your partner is choosing porn or over having sex with you, then there is a problem. And research suggests that when men become addicted to pornography, they build up an immunity to the pictures or videos over time. So if he needs more and more of that material to get that same effect, then tolerance could build up and potentially he won't be able to get aroused any longer. If this is the case, it may be beneficial to seek out professional from a sex therapist or a couples counselor, because then this is a much more complicated and serious issue.
Dr. Leah, our next viewer asks, are there any body parts that estimate or show penis size, like hands or feet? Or is this just a myth?
I love this question. I actually get it all of the time because I've only dated really exceptionally tall men. And oddly enough, I have had other men come up to me and ask me questions about my partner's genitalia. So I get this question more from men than women. But the short answer here is no, there is no relationship between hands, feet, or height and penis size. Studies consistently show that the size of our hands and feet are not related. Even placid penis size length is not an accurate predictor of erect penis size length. However, there is one clue. Man's fingers do give a strong clue as to their penis size, but it's not the overall length of the finger. It's actually the ratio between the second and the fourth digits on the hands that strongly correlate with the overall length of an individual's penis. So the lower the ratio, or how much shorter their index finger is than their ring finger, is linked to the longer their penis will be when erect. So this might sound weird, but the reason behind this is fetal development. Females and males are pretty much the same until week 8 of gestation, in which case the gonads begin secreting testosterone and AMH. AMH prevents the development of fallopian tubes, uterus, and the upper vagina. Once the gonads begin secreting DHT and testosterones, they attach to those androgen receptors, which affect the growth and development of many different body symptoms. Low levels of DHT may result in an underdeveloped or misdeveloped penis. So the amount of testosterone and DHT, as well as the androgen receptor stimulation, will determine the penis size. And the circulating testosterone in the womb will affect other parts of the body, including the ratio between your second and your fourth digits, or your index and your ring fingers.
If you have a question for Dr. Leah, please send an email to questions@allhealthtv.com. Find out more about sex talk. Go to askdrleah.com.